Assalamualaikum warahmatullahi wabarakatuh. This message is for our international community in Jakarta. I'd like to make sure that all of you are well informed about the status of this pandemic in our city, and therefore allow me in this opportunity to provide you with an update regarding the COVID-19 outbreak in Jakarta. Today is the end of the first phase of our transitions from the large-scale social restrictions, and it is also the moment for us to decide whether we will proceed to the second phase or we will extend the first phase of these transitions. Since the beginning of the outbreak, our commitment here in Jakarta has always been about the safety of our people. That is number one and will always be number one. Safety of our people is the utmost priority, and all of our policy in handling the COVID-19 outbreak here in the city are based on comprehensive data and scientific approach. We always refer to the data, and we do not do any sugarcoating. We present it as it is, and of course, this scientific approach is being used in every decision we made and every policy we made in the city. And therefore, in this opportunity, I'll present to you the latest development as a basis for us to decide what will be the next step. There are three issues that I will share. Number one is our testing result. Number two is our health services. And number three is the epidemiology that we have gathered. So on the number of the tests, in the past week, Jakarta has again increased its testing. Now, the total testing in our city is 3.6 times the requirement of WHO. The provisions of WHO is 1,000 testing per 1 million populations per week. For 6 consecutive weeks, we have conducted massive testing. The first week, which is the week of the 4th of June, the testing rate was 1,991 people per 1 million populations. The second week, the week of the 11th of June, the testing rate was 2,554 people per 1 million populations. And the third week, the week of the 18th of June, the testing rate was 2,806 people per 1 million populations. And then the fourth week, the week of the 25th until the July 1st, the testing rate was 2,920 people per 1 million populations. And the last one is July the 2nd to the 8th. The testing rate was 3,194 people per 1 million populations. And finally, in this past week, between July the 9th till July the 15th, the testing rate was 3,610 people per 1 million populations. So Alhamdulillah, in Jakarta, we're able to formulate policy based on accurate data, as we have been able to carry out testing 3.6 times of the WHO standard. And let me underline here, this is an RT-PCR test. And therefore, we can be sure that the data produced truly reflects the real conditions of Jakarta. So in total, until July 15th, here in our city, we have conducted RT-PCR tests on 299,438 people. We will underline this, that this is the number of people. This is not the number of specimen, because there are individuals who were tested twice or even more. And when we found someone who is positive and then undergoing treatment, and they have been a subject of tests more than once or twice. As for specimen, we have taken tests of more than 422,339 specimens. So Alhamdulillah, this number of tests also continue to increase due to collaborations of all laboratories in Jakarta. We have a collaborative network of 41 laboratories in the city, and this is a true collaboration between all institutions in combating the COVID-19 epidemic here in Jakarta. Now, what about the positivity rate? The WHO recommend a positivity rate of 5% or under as requirement for easing up the large-scale social restrictions. So if one region reports that the positivity rate is below 5%, but the number of samples or people being tested is still below the rate of 1,000 per 1 million populations, then that positivity rate is really questionable, meaning we can only rely on positivity rate if the number of tests is above the minimum requirement. Now, as you know, in the past 6 weeks, we have the rate above the WHO standard. What about the rate itself? Our weekly positivity rate in Jakarta was 4.4 in the first week. And then the second week, we had 3.1%. The third week is 3.7%. The fourth week was 3.9%. And the fifth week was 4.8%. So in the past 4 weeks, we were below 5%. However, this past week, our positivity rate has increased for the first time. This is back to 5.6%, and even the fact that we are below the national positivity rate, which is 12%, but still, this is an alarm that we need to make a more vigilant actions and more discipline in our society. That is for our positivity rate. Now, with regard to our last defense against COVID-19, that is our health facility. In Jakarta, we have 190 hospitals. Out of that number, 67 is referral hospital to treat COVID-19 patients. This is our last stronghold. Alhamdulillah, it has been prepared. We have 4,566 isolation beds for COVID-19, and we have 659 ICU specifically for COVID-19. In the past week, there has been an increase in bed occupancy rate for isolation bed in COVID-19 referral hospital from 34% to 45%. Yes, it is still below half of our capacity, but an increase of 11% is alarming. On the other hand, the ICU's occupancy rate have experienced a decline. Initially, our bed occupancy ratio for the ICU was 31%. This week dropped to 25%. What does it mean? It means the number of patients with severe symptoms who need ICU treatments have decreased. On the other hand, the number of patients with mild or moderate or even no symptoms has increased. The reasons for this increase is because our Puskesmas team, which is the community clinics and health services across the city, we have 334 clinics, are doing an aggressive active case finding. Our medical team going to the communities, coming to various different activities of people to find gatherings, to do testing and to do tracings. So many of those who were found were asymptomatic or with mild symptom. And often, most of them were unaware that they have been exposed to COVID-19, and therefore, some of them were being taken to our health facility to be treated. So even though there is no symptoms, but if those individuals were high-risk individuals, then we will then require them to be taken to hospitals and being isolated in the hospital. So if there is a case of emergency, we're able to respond immediately. So the aim is again to make sure that everyone is safe. That is the status of our health facility. Now it's about reproduction number. In the past few weeks, our reproduction number had always been under 1. The R0 is a number in the early days when the outbreak started. It was around 3 to 4. And then by early June, it reached 0.98, slightly below 1. Now, per July 12, as of July 12, the number is 1.15. What does it mean? It means in the past 6 weeks, the status of the outbreak remain not increasing but not decreasing either. It has always been stable for the past few weeks. What we'd like to see is a decrease in the number of the reproductions. Unfortunately, it continues to be around 1. So we do hope that in the next few weeks, we will see this number to continue to decrease. Now, given those 3 components, 1 is the testing, 2 is our health facility, number 3 is the epidemiology number, we have then decided not to continue to the second phase of our transitions. The large-scale social restrictions continue in the first phase. We are not easing it up. We are going to continue under the large-scale social restrictions in the transition period, meaning we are not opening more sectors, and some sectors were planned to be open. We have decided to postpone. For example, cinemas. That was planned to be open in the end of the month. We have decided to postpone it until the situation permits. And let me underline the message for everyone in Jakarta. It is preferable to stay at home. Unless it is truly necessary, do not leave your home. Please stay home. And if you do need to be outside, if you do need to be away, do not leave your face mask behind. Wear face mask anytime, anywhere. And make sure social or physical distancing is always there. Minimum 1 meter away from each other. And make sure to wash your hand with soap on regular basis. And make sure entering any facilities, you have to look around, make sure they're below 50% of its capacity. And under this phase, we required offices or any work spaces to allow only 50% of its capacity or 50% of its employee to be working in the same space, in the same room. We would like to make sure that everyone follow health procedures. Do not ever underestimate, truly do not ever underestimate about the dangers of COVID-19. Many have regretted because it took this pandemic easily and the consequences were too costly. There is one important fact about the disease here in Jakarta. 66% of those found positive in our testings were individuals with no symptoms. They have no complaints whatsoever about their health. But when they were tested, they were found to be positive. So this is not a minor fact to be taken lightly. We need to take it very serious. And we may be feeling tired, we may feel bored being at home, but the problem is we're dealing with a virus that never gets tired. So let's not get tired of this. Let's overcome this challenge. And we need to remind everyone that this is not only the job of the government. This is also a moral obligation, a moral responsibility for everyone. I'm calling everyone to remind anyone that you see we're not following the protocol. If you see someone not wearing a face mask, do remind them to wear a face mask. For what? For the safety of everyone. And this is again a duty that all of us need to undertake, and let's make sure that the public health is the utmost priority for all of us. That is the message I would like to share with everyone, our international community here in Jakarta. I would like to make sure that you feel home and you feel safe. And if you do need anything, do let us know. You can reach us through our social media or 112. That is our emergency number, and we will be responding immediately. We do hope, and we're optimistic, we will be able to overcome this challenge, and we do hope very soon we're able to come back to our activities, and everyone safe and feel home here in Jakarta. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.